What is a birth plan and will my doctor follow it? Well, a birth plan is something that you decide for yourself and your baby. Now, it is your decision. Generally, most women who have this birth plan are the ones who are extremely empowered, and they are the decision makers in what's going to happen with them. And it's very, very typical. They will have sometimes a doula, sometimes a caregiver with them. They will have their husband, they will have their mother or their sister, and that's that emotional one support person who's going to be supporting them throughout what she wants. Birth plan does not exist for someone who does not want to take that responsibility, or who's scared, who has that emotional support system in the form of mother or husband, but then they along with her are making the decision for her. So if you are someone who's curious about what a birth plan is, you can find it on Google. I don't really create a birth plan for you, but if I'm your doctor or you want your doctor to follow it, it needs to be in written. You need to write it down in paper. It's generally documented, and she will tell exactly all the things the way you want it. So the kind of birth plans that I have seen and I have respected it, say something like, I don't want the lights on. I want the candles. I want only one person coming in the room. I want no one to talk loudly. I want someone to not use the word contractions, but use surges. Don't use harsh language. I don't want any intervention. I don't want a cannula. I want a birthing ball. I want access to a bathtub. I want a midwife-led delivery. Some of them will be like, I don't want an episiotomy. I would like to tear naturally. I don't want any intervention on the baby. Some of them will actually say, I don't want the baby to be monitored continuously, just intermittently. They will say, I don't want the placenta to be pulled out. It should release on its own. I don't want the vitamin K for the baby. All of these things. I want skin to skin after the baby is born. So these are the birth plans which generally doulas and midwives take care of, and patient will have this birth plan with her when she comes in labor. Now, most doctors are programmed to keep you safe and your baby safe, because if you and your baby safe, they are safe. Now, they don't understand this in-between things. They just don't, and they don't care. They are like, listen, you came to me for a service and I will not do all these things. Your doctor might actually say that. We have said this to patients who are extremely high risk, who need to be monitored, who need to be intervened multiple times, and it's not fun and it's not the way patient wants it, but we do it because in our brain that is the right thing to do. But in your brain, this is the right thing to do. Your birth plan needs to be respected. And remember that if you actually write this down, if you actually foresee, you actually predict that, okay, this is how my birthing process is going to be. And there are so many patients who okay, if the baby is not okay or I'm not okay, I am willing to move. But that conversation needs to be two ways, as in the doctor explains to you and then you understand what is going on and you are in the right state of mind to make that decision. So the birth plan is a decision made ahead of time by you, by your higher self, right? It's not something high tech, it's just something which patients do beforehand, and they write it down and they tell the patient, they tell the midwife, and we respect it. Most of the time patients get what they want and they have that birthing experience just the way they want it. It's your job to ensure that everyone follows that. Now, if you are someone who doesn't have a birth plan or is not feeling the courage to create a birth plan, you can bring it to a coaching call. Not everyone is necessitated to have this birth plan. We will make it for you. We have a policy we follow. Most doctors, if you come in labor, everything is going well, we will try for normal delivery. We have things, the what do you call, care plan that we follow for all patients. So you will have your baby. The baby is coming anyway. So the birth plan and all of these are just strategies that your brain comes up with so that you have a good experience. And blissful pregnancy is all about this good experience. So ensure, go through what it is and try doing that.